Gabby.
I'm Josh.
And I'm Zoe.
And this video is on secondhand smoke.
According to the CDC, secondhand smoke is smoke from burning tobacco products, such as cigarettes, cigars, or pipes. It is also smoke that has been exhaled or breathed out by the person smoking. Tobacco smoke contains more than 7,000 chemicals, including hundreds that are toxic and about 70 that can cause cancer. There is no risk-free level of secondhand smoke exposure. Even brief exposure can be harmful to health. So what does that mean for the person who breathes secondhand smoke?
Secondhand smoke causes numerous health problems in infants and children, including more frequent and severe asthma attacks, respiratory infections, ear infections, and sudden infant death syndrome. Some other complications may include stroke, lung cancer, and coronary heart disease for adults. For non-smokers, breathing secondhand smoke has immediate harmful effects on the heart and blood vessels. It is estimated that secondhand smoke caused nearly 34,000 heart disease deaths each year during 2005 to 2009 among adult non-smokers in the United States. Secondhand smoke exposure caused more than 7,300 lung cancer deaths each year from 2005 to 2009 among adult non-smokers in the United States. Since 1964, the CDC estimates that there have been 2.5 million deaths associated with secondhand smoke inhalation.
Secondhand smoke can cause lung cancer in adults who are non-smokers. Those who are exposed to secondhand smoke at home or at work increase their risk of developing lung cancer by 20 to 30%. More than 7,300 lung cancer deaths among U.S. non-smokers occur each year. Secondhand smoke is attributed to 41,000 deaths among non-smoking adults and 400 infant deaths per year. Smoking during pregnancy results in over 1,000 infant deaths each year. In general, tobacco use is the largest preventable cause of death and disease in the United States. Each year, approximately 480,000 deaths occur from complications due to smoking. Further, more than 16 million Americans suffer from at least one disease caused by smoking.
Next, we're going to do our role play. I will play the father, Gabby will play my daughter, and Zoe will play the nurse.
Hi, my name is Zoe. I'll be your nurse today. What are your names?
I'm Gabby.
And I'm Josh.
It's nice to meet you both. Gabby, are you going to be my patient today?
Yes, ma'am.
Awesome. And how old are you, Gabby?
I'm 6.
What brings you guys in today?
Well, I've been kind of having a hard time breathing.
Okay, and can you explain to me how it feels when you are having trouble breathing?
Well, my chest starts to kind of tighten up and sometimes I cough.
Okay. And is this something that's new or has this been going on for a while?
Well, she's diagnosed with asthma at the age of 3, but since then it's just kind of been getting worse.
Okay. And Gabby, does anything make your asthma attacks better?
Well, I have them less when I'm at school, and I think when I'm outside I don't really have them as bad.
Okay, does anything make it worse?
Well, if I'm inside and if I'm around the smoke.
Okay, what's smoke?
Oh, I smoke.
Okay, what are you smoking?
Just cigarettes.
Okay, do you smoke inside of your house?
Yeah, I do, and also in the car.
Okay. How often do you smoke?
Well, I picked it up 3 years ago, and I don't know, if I had to put a number to it, I'd say at this point, 2 packs a day.
Okay. It sounds like Gabby might have developed more severe asthma attacks than we had originally diagnosed.
What would cause that?
Well, if Gabby's around a lot of smoke, she can develop some complications due to the secondhand smoke that she inhales. It's easier to inhale more if she is around smoke, if you smoke in the house or in your car with her. And secondhand smoke can cause some health problems in infants and children, including more frequent and severe asthma attacks and some respiratory infections and ear infections.
Okay, so What can I do to like help that?
Well, there's a few things you can do. You can try and stop smoking inside your house or in the car when you're with her. Instead, you could go outside and try smoking outside of the house, or leave the windows open in your house to get some of that already smoky air out when the weather is good.
Okay, I can probably do that.
Am I gonna die?
No, sweetie, you're gonna be fine. We can do our best to reduce the severity of your asthma attacks, and what you can do is try not to be around the smoke, whether it's your dad smoking or anyone else, and try and stay in the areas of the house where there hasn't been smoking or a lot of smoke, and also roll your window down when you're in the car.
Okay, thank you.
Do you already have an inhaler?
Yes.
Do you know how to use it?
Yeah, one of the nurses showed me when I got it.
Okay.
Do you have like any services that I could use that would help me like maybe quit or make it so I don't smoke as often?
Absolutely. There are some websites and online resources that I can send you, and I can also send you out with some of the pamphlets for our local resources that we have in town.
Okay, that would be great.
Awesome. Do you guys have any other questions?
I don't, but
I don't think I do.
Of course. Thank you both so much for coming in, and Gabby, thank you for being my patient today. You can always come back in if your asthma attacks don't get any better, and you can try something else.
Okay, thank you.
Of course.
So far, we've discussed the effects of secondhand smoke, including symptoms and the diseases it can cause. Secondhand smoke can cause more than just respiratory damage. In infants and children, secondhand smoke can cause severe infections and even death. In adults, it can affect vascular health and may increase the risk of developing a stroke. It's not enough to just not smoke or stop smoking. We must change our environment in order to maintain our respiratory health. We understand secondhand smoke is harmful and should be avoided when possible. What are some ways we can avoid being exposed to secondhand smoke?
some ways to avoid secondhand smoke include avoiding bars and restaurants that allow smoking and limiting your time spent with regular smokers. Encourage family members to quit or smoke outside. And if you are a smoker, try to open the windows when smoking in the car and avoid smoking inside or near other people in enclosed spaces. Some other things you can do is educate friends who smoke about the dangers of smoking nearby their children or family. According to Healthy People 2020, as a community, we can help pass laws against smoking in public areas, especially in school areas and at school events. You can also try to limit your time near smokers or places where there are a lot of smokers. To recover from smoke inhalation, you can increase your time away from smoke, which allows your lungs time to heal. You can go outside or away from where there is smoke, and drink water to help clear any smoke in your lungs.
According to the CDC, you can protect yourself and your family from secondhand smoke by quitting smoking if you are not already a non-smoker. This can help protect those around you from developing complications of secondhand smoke. You can also not allow anyone to smoke near you or in your home by not allowing anyone to smoke in your car, even with the windows open, making sure that your child's daycare center and schools are tobacco-free, seeking out restaurants and other places that do not allow smoking, teaching your children to stay away from smoke, and being a good role model by not smoking yourself.